Communicating human biomonitoring results to individuals can be a challenging task. It is essential to effectively get the message across about exposure and interpretation of human biomonitoring results. Individuals should know what the level of chemicals in their blood or urine means for them and what they can do with their information or with the result that they have received. The knowledge level in terms of human biomonitoring, exposure to chemicals, and perception of risk may vary between different stakeholders, including citizens. Approximately 84% of European populations are concerned about the impact of chemical exposure to chemicals, emphasizing the need for a well-defined communication strategy in place. We want individuals to be interested and motivated to get the results, but without becoming overly concerned about the impact of exposure to chemicals when there is no direct link. The way information is communicated and received by different stakeholders, including policymakers, science, citizens, and media, is seen to have a crucial role in the quality of the policies and public reactions to them. The result of human biomonitoring studies are most often communicated on the group level. However, some countries, such as Netherlands, have experience in communicating the results on an individual level. In such a setting, it is possible to indicate, for example, if the lab result of an individual is above or below the group average. In these cases, individuals can discuss their results with an expert in the field or with the medical doctors to see if their result may relate to their medical history. However, it is important to explain to them that two individuals in the same exposure setting may have different results due to inter-individual differences in activity pattern or normal body physiology. Human biomonitoring accounts for these differences and can contribute to explaining differences in risk. What is also interesting as a challenge is that often analyzing body fluids is associated with the medical exam, and individuals perceive the lab result as relevant to their current or future health status. It is important to highlight that often human biomonitoring alone cannot provide information on the health status at an individual level, and complementary informations are required to better interpret human biomonitoring data and also to make a conclusion regarding the associated health effect. Overall, we encourage that participants should receive individual results unless they refuse to be informed, along with the guidance on what the result means for them. This guidance also should acknowledge the uncertainties and provide information on the action to take and be consistent with the public health policies. Here, science plays a key role in terms of both creating knowledge and offering procedures that involve citizens at the high levels, as they ask to be provided with the trustful, correct, and validated information. Therefore, communication should take place within scientific studies from the outset to increase transparency. In addition, improving the study design and collecting complete metadata, such as exposure information, can improve also the interpretation of human biomonitoring data and decrease the uncertainties. Finally, we must have in mind that uncertainty is part of science, and communicating it in the correct and transparent manner is important. Overall, we need a guidance for communication, and validated and trustworthy communication means with transparent, clear, and non-complex scientific language. We need to work together to improve communication strategies for human biomonitoring.